Bailey Roy.
And I'm Chloe Myers, and we are nursing students here at Fairmont State University. And this presentation and project is for a mental health clinical and course that we are currently enrolled in.
With this presentation, our goal is to teach you a little bit about forensic nursing and what it is while we reference cited sources from nursing sources.
All right, so forensic nursing is a specialized field that bridges healthcare and the legal system, and these nurses play a critical role in caring for patients who have experienced trauma, violence, abuse, while also helping collect evidence based on that trauma for certain cases.
Forensic nursing is a unique combination of nursing science and forensic science. It involves not just treating physical and emotional injuries, but also working closely with law enforcement, attorneys, and forensic experts to ensure that justice is served.
All right, so what is forensic nursing? Okay, so according to the ATI RN Mental Health Nursing Book and resource that we used, they define forensic nursing as this. It is a combination of a biophysical education and forensic science. It is the utilization of nursing science to public or legal proceedings. The registered nurses use scientific investigation, collection of evidence, analysis, prevention, and treatment of trauma and or death of perpetrators and the victims of the violence, abuse, and traumatic accidents that occur.
A forensic nurse is a registered nurse or advanced practice nurse who has received specialized training in handling victims and perpetrators of violence. Their role is integrated into patient care, helping individuals with both acute and long-term health consequences of trauma. They don't just provide medical treatment, they also collect and preserve evidence, testify in court, and help victims navigate the legal system. They might work in hospitals, correctional facilities, crime labs, or even as death investigators.
All right, so a little bit on the history of forensic nursing.
We're here on the right. The history of forensic nursing is filled with milestones that shaped this field. In 1986, Virginia Lynch first proposed forensic nursing as a specialty, and by 1991, the American Academy of Forensic Sciences formally recognized it.
And by 1992, forensic nursing had its own professional association, the International Association of Forensic Nurses. And since then, in the recent years, in like the 2000s, forensic nursing has extended and expanded all over the world, not just here in the United States. And there are certain specialty programs that have been created, including programs that deal with sexual assault, psychiatric forensic nursing, correctional nursing, and death investigations.
All on the board here.
Also, the American Nurses Association recognizes the forensic nursing as a specialty, and that began in 1995, but it can be rooted back in the 1970s. Since then, nurses saw better care and need to care for patients who have experienced sexual assault. And then the sexual assault nurse examination program started around 1976 in the late 1970s.
So next we are going to be talking about different types of forensic nursing, and this is on our board.
In red, right here.
All over the corners. So first, forensic nursing isn't just about crime scenes. There are many different specialties, including sexual assault nurse examiner, the SANE nurse, which provides care for sexual assault victims and collects forensic evidence. Number 2 is correctional nursing. They work in jails or prisons, providing healthcare to inmates. 3 is the forensic psychiatric nursing. Cares for patients with mental illness in legal settings like psychiatric hospitals or correctional facilities. The last one is death investigation. Some forensic nurses assist in autopsies or act as coroners to determine causes of death.
And no matter what the nurse's specialty is, these nurses must remain unbiased and focus on providing ethical, evidence-based practice care while preserving any of the legal integrity of the case with the patient.
I don't know if anybody knows how to become a forensic nurse, but we're going to talk a little bit about that on our board here. So how do you become a forensic nurse? The most common path is starting as a registered nurse, an RN, then obtaining sexual assault nurse examiner, the SANE certification. This involves 40 hours of classroom training, 40 hours of clinical training, including forensic exams. And I'm going to cite one of our sources that we have. So according to ATI Mental Health Nursing Edition, these nurses have advanced training in the collection of evidence for suspected or actual cases of sexual assault and other forms of physical abuse.
So forensic nurses can also pursue a master's degree or a PhD specifically in forensic nursing, but an advanced degree isn't always necessary in every area of practice. So some of these forensic nurses train as death investigators, or they can work in correctional facilities, and that's just a few of the examples. But if a community lacks like the field of forensic nursing, RNs can advocate for creating new positions that is specific to forensic nursing.
And our next topic is how forensic nurses help patients. So, forensic nurses work with victims of violence, abuse, and trauma, and they have multiple responsibilities. These responsibilities include assessing injuries and providing medical care, collecting and preserving evidence like DNA swabs, clothing, and injury photos, documenting injuries for legal cases, testifying in court and expert witnesses, and lastly, advocating for patient safety and mental health resources.
So these nurses also work and help patients who are perpetrators of crimes, ensuring they receive necessary medical care and the appropriate psychiatric evaluation needed after these crimes are completed and committed. So these nurses have to balance the healthcare system and the justice system while treating all these patients with the utmost respect and dignity that they can provide.
Our next topic is mental health and forensic nursing. Over here. They go hand in hand and work together with this. Forensic nursing and mental health go hand in hand. Many victims of trauma struggle with PTSD, depression, or anxiety, and forensic nurses provide crisis intervention, emotional support, and mental health assessments.
So forensic psychiatric nurses work with patients in jails, psychiatric hospitals, and crisis centers, and they evaluate whether someone is competent to stand trial or they need inpatient care. And these nurses play a key role in treating patients with schizophrenia, bipolar disorder, or any type of substance abuse issues.
However, forensic nurses themselves can face burnout and emotional exhaustion. Seeing trauma, abuse, and violence daily definitely takes a toll on them. Self-care, peer support, and mental health resources are critical for forensic nurses to continue their work.
So it's important for these nurses to practice healthy coping skills for themselves while treating and caring for these patients, because it can lead to burnout and just have a decline in their mental health. So some healthy coping skills can be deep breathing techniques, walking outside, exercising, seeking out help from other professionals such as counselors, like in going out to their peers and their friends and asking for help. And with these healthy practices, this can help them in processing all the situations and traumatic experiences that they have to walk alongside with these patients, so they're able to process and remain unbiased and not have any more decline in their mental health. These nurses have to be able to cope with this situation so that they're able to provide the best care that they can to these patients who are experiencing traumatic things like sexual assault and different crimes that are committed against them. So if they're struggling with their own mental health, they're not able to adequately provide the care that they know they can for these patients. Okay, so for our sources and like resources that we used, We use several different nursing websites and journals and some books. So here's a list of a couple of those. We use nursingworld.org, and it was just a specific about forensic nursing. We use forensicnurses.org. We use Xavier University's website on forensic nursing. We use the ATI-RN Mental Health Nursing book, Chapter 6, that discusses different types of forensic nursing. We used a forensic nursing journal written by an assistant professor named Shelby Mole at Bethlehem College of Nursing. And we also used the History of Forensic Nursing journal written by, it's a journal / like book chapter that she wrote, and the author's name is Meredith J. Scannell. All right, does anybody have any questions? Thank you for listening to our project and all the information that we have for you.
Thank you for taking the time, and we
Yeah.
appreciate you. I hope you learned a little bit about forensic nursing, and yeah,
Thank you.
thank you. For our activity, we tried to come up with a real-life scenario for forensic nursing and some interventions that could possibly happen. With forensic nursing intervention, the hospital's forensic nurse examiner, a trained sexual assault nursing examiner, SANE nurse, was called to assess and support Jane Doe. The forensic nurse followed a trauma-informed care approach, ensuring that Jane felt safe and empowered throughout the whole process.
All right, so now that we've met Jane, we're just going to start and walk through what the care could possibly look like as the forensic nurse. Okay, so we're going to first start with providing medical and emotional care, just overall care. So we're going to conduct a head-to-toe assessment. We're going to document any visible injuries, so if she has any bruises, cuts, scrapes, anything that's on her body that we can physically see. And if she has any pain, we're going to report that as well. We're going to make sure Jane's okay with getting screened for STIs, which is sexually transmitted infections. And we're going to go ahead and give her prophylactic treatment to help prevent any possible infections that can be starting and help prevent pregnancy, or if that has occurred, type thing. We're going to follow the protocols of the agency or hospital that we're at. We're also going to make sure we provide psychological and mental support. So we're going to refer her to a crisis counselor and just let her talk to us if she needs somebody to talk to about the experience, or not talk and just be there with her.
Another nursing intervention would be to get forensic evidence collection. So with Jane's consent, the forensic nurse performed a sexual assault evidence collection kit. It's a SAEK, so that will be collecting swabs, clothing, and fingernail scrapings. They will be also taking photographs of injuries for documentation, and a chain of custody was established to ensure the integrity of collected evidence.
All right, so now that we have assessed her in a physical way and a mental way and done all the evidence collection that is needed to help in the justice system with the case, we're going to go ahead and move on to the legal and ethical considerations that can happen and will occur. So we're going to inform Jane about her legal rights, which includes the option to report the assault to law enforcement. Now that we have collected all the evidence, she can choose whether or not she wants to report that and have that evidence used. We are going to continue to maintain confidentiality always, while following the mandatory laws that we need to do to report that such a thing as this assault has happened. We have to report these to the certain agencies so that we follow the right chain of command. And then we're going to make sure we have a detailed report that will be compiled so it can be used in court if Jane does decide to pursue legal action, and make sure everything is covered so that she can have the best outcome.
And the outcome and impact, Jane was given a follow-up plan because we don't want to end our care just when she leaves the hospital. We want to follow up, give including mental checkups and mental health counseling, because a lot of these sexual assaults and people that come in with that type of stuff, they later on have mental health problems and stuff like that. The forensic nurse comprehensive report and evidence collection ensures that Jane had the option to seek justice if she chooses to. Not everybody wants to or has to, so they get the choice to do so. The intervention minimized Jane's risk of re-traumatization and provided her with the necessary resources for recovery. I feel like some people already are traumatized enough through what they went through, so the same nurse should try to make this the least traumatizing as they can and kind of make them feel comfortable and stuff like that through this whole process.
All right, so now we tried to create some questions, so hopefully they make sense.
We're gonna talk a little bit back and forth
yes,
and maybe
just go
say
through
what
them.
we think it is and then the answers.
Yes. Okay, so first off, what steps did the forensic nurse take to ensure Jane's physical and emotional well-being during the examination? Okay, I'll kind of talk through this one. We can just go back and forth. So some of the steps that she did take was she followed the trauma-informed approach, which ensures that Jane felt safe and was safe, and she felt empowered throughout the process while we helped her. We conducted a head-to-toe physical examination, which included documenting the injuries and anything that we saw. We provided STI screening, prophylactic treatment, and emergency contraception. We also provided physiological support and a referral to a crisis counselor or somebody for her to speak to. So those were the steps that we did to ensure Jane's physical and emotional well-being.
Another question that we have is, how did the nurse apply trauma-informed care principles in Jane's case? So we ensured that Jane had control over the process, like how we said before, giving those options for her, obtaining consent at each step, used gentle, non-judgmental communication and validated her feelings, because that's another important step in everything, making sure that they feel like their feelings are validated and being there for them. We created a safe environment, reducing stress and re-traumatization, like we talked about before.
All right, here's another question. Why was it important for the forensic nurse to obtain Jane's consent before evidence collection? All right, so it's important for us to obtain her consent because we want to still respect Jane's autonomy in her freedom and in her choices, to make sure she still has the right to make those decisions. We want to continue to follow all the legal and ethical standards that we as nurses live by. So without consent, the evidence collection would be unethical and potentially inadmissible in court. And we want to make sure that we continue to empower and give Jane control over the situation so that she can feel like she still has control even after experiencing this trauma from the assault.
Next, we are going to ask some questions about the forensic and legal considerations with this case. What measures were taken to ensure the chain of custody for the evidence collected? So each piece of evidence was labeled, sealed, and documented with timestamps. That's very important when taking evidence. A detailed log of who handled the evidence was maintained. The forensic nurse ensured evidence was transferred securely to the law enforcement or forensic labs. And that's another big thing, because we do not want to lose any of these, and then we'll have to go back and re-traumatize them again and have to do it over again. So that's a big thing.
Alrighty, let's see. Another question. I'm gonna kind of skip. So what role does the forensic nurse's documentation play if Jane decides to pursue legal action? So with our documentation, since it's so detailed, this serves as objective evidence in court, and just everything is written down, like she said, with all the timestamps and all the different tests that we had completed. The injury documentation and photographs can help with Jane's testimony. It can help provide a solid roots of what happened with proof and evidence. And the nurse may also could be called as an expert witness to explain any of the medical findings to help with Jane's case.
Next, we are going to talk about ethical and psychological aspects. One is, why is it important to refer Jane to mental health counseling and follow-up medical care? Like we said, it doesn't just stop when they come in. We have to continue care after they leave. So one is, sexual assault survivors are at high risk of PTSD, depression, and anxiety. Especially with everything they've went through, it is important to continue checking on them and doing mental health assessments and even referring them to other people. Long-term health effects, such as the STIs or pregnancy, things like that, they require monitoring, so they can come back in and still be monitored for all of that. Counseling helps with coping strategies and emotional recovery.
So here's one last question for this particular case study based off SANE nursing and sexual assault victims. If Jane had refused forensic evidence collection, how else could the nurse have supported her recovery and legal options? So as a forensic nurse, if Jane had said no, she doesn't want to have that evidence collected or go through that, we could just continue to provide medical care as a normal nurse does, just without collecting any evidence. So we wouldn't do the exams of the STI treatment or assessing any of her injuries. We could and we would also educate her on her rights and options for the delayed reporting. So if she does choose to do that, we can inform her of how the justice system views those processes with reporting and just taking her time with that. And then we could also just report her to any type of crisis center based on her assault for emotional support, so that she can have somebody if she's struggling to process what happened in that situation type thing.
So that is one of our activities, part of our activity, and here in the next section we'll go into another part of our activities, maybe with another case study. To finish up our presentation and our video, we are just going to go through some review questions from our topic before. So the first question is, what is the primary role of a forensic nurse? Here are the options. A, performing surgeries in emergency situations. B, collecting forensic evidence, providing medical care, and testifying in court. C, prescribing medication for trauma victims. Or D, only working with crime scene investigators. We'll give you an answer to think about, a second to think about it. And the answer is B, collecting forensic evidence, providing medical care, and testifying in court.
All right, here's one more question. Why is mental health support important for forensic nurses? A, forensic nurses only treat physical injuries, so mental health support is not necessary. B, forensic nurses frequently experience burnout due to exposure to trauma, requiring self-care and mental health resources. C, forensic nurses should focus solely on legal evidence collection and avoid emotional involvement. And D, mental health support is only needed for patients, not forensic nurses. Give you a second to think. All right, so the answer is B. Forensic nurses frequently experience burnout due to exposure to trauma, requiring self-care and mental health resources.
And forensic nursing is a challenging but rewarding career. It blends medical care, mental health support, and legal expertise.
Whether working in hospitals, correctional facilities, or courtrooms, forensic nurses play a key role in bridging healthcare and justice together. So,
thank you all for
thanks for listening.
Do you have any questions?